First of all, just to say that I think the context of this debate happens in, people will remember quite vividly the Joe Duffy series of programmes in April, when the item on experiences of women in our maternity hospitals had a response of many, many hundreds of women who contacted the show and had negative and very often very harrowing experiences of giving birth in Irish hospitals. It was one of the largest responses the Joe Duffy show had ever had, with many women wanting to share their experience publicly. And why, I think we have to ask ourselves, have the experience been so poor for so many women? And I don't think it is just because that the midwifery or the nursing staff in the ward with them at the time had treated them badly, or a combination of a failure of resources with that and services provided by the state, or even the deeper issue of the paternalistic delivery of services. And I think that this is important to the debate, that which is known as active management and stems from a decision to pursue this in the 60s. It does have positive outcomes, but it also importantly means speeding up the labour process by breaking the waters and using synthetic hormones. By its very nature, this leads to more interventions during labour, but it also results in a highly prescriptive and medicalised birth process. It's also one that can leave women feeling ignored, disrespected and disempowered. And many women will make the point that they feel safer and better and have better outcomes during birth if the team that looks after them is midwifery-led. But I think this is also a problem that stems from the failure of this government and previous governments to properly staff and resource maternity services. And we know from the nurses' strike recently that we do have a crisis in retention and recruitment of nurses and midwives. And I'm unsure whether the deal that ended the strike will result in an improvement in that retention and recruitment in the number of midwives that we need. There was a recent tragic case in Cork where a mother and child died, and this highlights how chronically understaffed and how overstressed much of our maternity services are. This is not to claim that that tragedy directly related to the staffing issue, but the staffing issue was very clearly highlighted, where that evening 31 patients on a labour ward were being cared for by 3 nurses, and that is really stretching the resources. These ratios, however, are not confined to that case, and it's systemic across maternity and other services. Again, during the recent strike, I think a lot of us who spoke to nurses and midwives on the picket line would have been struck by what distressed them more than just the lack of pay parity and the inequality between their grades was the danger that they had to live with putting their patients in on a daily basis, and this was as a result, direct result of the lack of staff and resources. So yes, the core problem that many women face is structural and deep, and in many cases goes back to an attack on public services, on nurses by this and other governments. Addressing them in isolation is impossible to do, as they're embedded in the general undermining of our health service through the ongoing privatisation and the building of a two-tier health system. In that context, I was struck by part of the motion, and indeed the amendment, that calls for a guarantee that the new maternity hospital will not have separate external or internal entrances nor separate facilities within hospitals. This issue, I would argue, is very, very important indeed, and it's not about maternity hospitals having just separate entrances and exits for private or public, but the fact that we have a two-tier health service, private and public mixed in together, the fact that the ratio of nurses and midwives and access to essential services and resources often differ between these two health services. And it's the fact that we have privatised the health system and continue to do so that is really disturbing. And I think that that needs further discussion and further opposition within this House. Thank you.